We are joined now by Dr. Haywood Brown, the incoming ACOG President. First of all, congratulations, so exciting.
Thank you very much.
Tell us about what you hope to achieve for this year as President.
My lifelong career has been about perinatal health disparities, particularly in maternal mortality. And we are working on several things related to that, including access to care. But our focus is going to be on redefining postpartum care, which looks at pregnancy as the gateway to long-term health. There are a number of problems that occur in pregnancy that increase a woman's risk for long-term health issues, such as diabetes for long-term diabetes. We're looking at things like hypertension, that is a risk factor for cardiovascular disease, and looking at prematurity as one of the preludes to cardiovascular disease. So the emphasis in the postpartum period is going to be on counseling, pregnancy health, long-term health, interconception care, and so forth. So the first thing we have to do is eliminate the paradigm of women only needing to come at a 6 weeks visit. We believe that women need to come earlier on counseling on breastfeeding, on achieving a healthier weight, on screening for postpartum depression. And then there needs to be a second visit at some time before 12 weeks that's focused on her long-term health. That's one goal. The next thing that we have been working on is something called the levels of maternal care, which is based on a premise that certain women with certain complications need to be at a facility to better take care of them. A lot of our care, of course, is done in rural hospitals and hospitals with smaller volume. So if you identify a patient with a major pregnancy complication, that patient may need to be transferred, and there needs to be a partnership between the accepting hospital and the referring hospital. Now, how do we go about doing that? We go about doing that through things like telehealth, telemedicine, and we have not embraced technology the way that we should in order to achieve better health care. So my theme for my ACOG presidency is about innovation and technology in women's health. And part of that includes telehealth, telemedicine, teleconsultation.
Thinking as a whole for the profession, what do you see for the future?
The future is identifying the specialty of OBGYN as a source for women's health. We're the only physicians where all of our patients are women. And so logically, most women see their OBGYNs as their doctor. And therefore, we should be the person who is directing their health from a preventive perspective as well as a pregnancy perspective for reproductive life planning. And so re-educating a workforce on that in a team-based care format where the OBGYN is working with their advanced practice providers to take care of women throughout their lifespan, from adolescence through the menopause and so forth. So that's really the theme. And we're taking off on some themes from previous presidents, including the Well Women's Task Force, in order to be able to achieve that. So there's so much for the obstetrician gynecologist to do when it comes to patients and patient care and so forth. The other thing that I think that we have to do is to have better patient education. And many of our materials that we give, for instance, are not geared to the young patient who goes on the internet and looks up a problem. So ACOG should be the go-to source for patient education. If you type in a problem such as miscarriage, and we should pop up the ACOG website, link that patient to the appropriate resources so that they'll be better educated about what their concerns are, what their risks are, and so forth. This is what I mean by technology. Using technology, whether it be video conferencing, vignettes, and so forth. And ACOG is going to do that so that we can better educate our patients and better educate our providers.
Dr. Brown, tell us a little bit about the importance of advocacy for providers.
As OBGYNs, our focus has always been on what is best for women's and women's health throughout the lifespan. And as a result, we see ourselves as the primary advocates for women's health. you know, there are many challenges with regard to women's health, women's reproductive rights, etc. And we want to make sure that ACOG is seen as the leader with regard to what our providers are doing and what our patients need. And so the goals are to always advocate for the best in women's health care throughout their lifespan. And ACOG is geared up to continue to do that and keep the promise that we made, that Dr. Gelhaus made, the previous president, and previous presidents to that, for our leaders. And that means that we have to engage our young OBGYNs to get them involved and to keep them involved for the overall goals for women's health for their patients.
Very exciting. It's such important work. Thank you so much, Dr. Brown. Appreciate it.
Thank you.